There we go. Okay. Sorry about that. Again, welcome today to today's presentation. My name is Nick Severino. I'm the Vice President of Marketing here at First Stop Health. I'm just going to be helping coordinate some things at the beginning and end of today's presentation. But I just want to cover a few logistical items just to make sure before we get in to the heart of the presentation. Again, you can ask questions anytime using the Q&A feature in your toggle. We'll do our best to answer those at the end. We do expect the webinar to only last about 30 minutes, including that Q&A at the end. And yes, we are recording. That is one of the questions we'll get a lot in the Q&A. We are recording today's presentation, and we will send that to everybody here within the next week or so. So before we dig into the presentation, let me actually introduce today's speaker. Dr. Eric Bricker is with us. He's our Chief Medical Officer and Chief Growth Officer at First Stop Health. He is an internal medicine physician and is the former co-founder and Chief Medical Officer of Compass Professional Health Services, which was acquired by Alight Solutions back in 2018. Dr. Bricker graduated with honors from the University of Illinois at Chicago College of Medicine and completed his residency in internal medicine at Johns Hopkins. He then went on to practice medicine at the Baylor Scott and White Health System in the Dallas area. Prior to medical school, Dr. Bricker worked as a hospital finance consultant with a company that is now part of Huron Consulting Group. His experience treating patients and seeing firsthand the impact of healthcare cost, quality, and access on people's lives is what drives Dr. Bricker's passion for improving healthcare. He is coming to us live today from Texas, where he resides with his family. So Dr. Bricker, I will hand it over to you.
Well, thank you so much, Nick, and thank you to all of you for joining me today. And listen, I've seen the attendees that are on now, and I see tons of familiar names. So I feel like it's a reunion. So it's just a joy to be able to reconnect with so many of you. And I won't mention you by name. I also see some new names on there as well. So it's fantastic to have new friends joining us. And I will just add, Nick, thank you for the wonderful introduction. That was very kind of you. Many of you have probably seen that after I left Compass, I started making these healthcare finance videos called A Healthcare Z. And I've got over 3,000 people subscribed to getting these daily, and I post them on LinkedIn and YouTube, and I get like 90,000 views a month. I'm just like shocked at how much people love being educated about healthcare finance. So thank you so much for watching those as well. Now, of course, today's topic is the 5 reasons why standalone virtual care excels. And many of you, because of this age of the pandemic that we live in, have probably seen with your employer groups, or if you are an HR employee benefits professional yourself, you've seen it across your employee population of just an increased need for help, and an increased need for help on multiple levels. One, help with your health, and given the ebb and flow of the pandemic, being able to do that virtually, whether you're at home or you actually are at work, or maybe you're even in your car, to be able to have that flexibility to have care. I mean, literally during the height of the pandemic, telemedicine utilization was up like 38 times what it was pre-pandemic. And then of course, everyone has been so, understandably so, under so much duress and stress that it really has created a need to connect with and be seen by mental and behavioral health professionals. Whether that's in the form of counselors with cognitive behavioral therapy, et cetera. And we've really seen a challenge across the country with access to these types of professionals. It's really hard to make an appointment. It's hard to find somebody that's in network. And so when I got a call from Blaine Barnett, the CEO of First Stop Health in June, and was offered the opportunity to come work at First Stop Health, I said to myself, I would be a fool if I did not take up this opportunity. And so I have joined First Stop Health, and I will tell you that the people here are fantastic. And I literally wake up every morning early because I'm so excited to be able to work with these folks. So of course, when we're talking about telemedicine and virtual mental health, almost everybody has it baked in through their carriers today, right? So that is like nothing like new. But the point is that First Stop Health has specifically gone the route of being standalone and not baked in with the carrier. And so the whole point of today's discussion is, okay, as you as a broker consultant are going through these options with your employers, why would it be helpful, and in what situations would it be helpful to have standalone telemedicine and virtual mental health? And then if you're an employee benefits professional, HR professional, why would your employees specifically benefit from a standalone solution versus those that are baked in with their carriers? Because First Stop Health has been supporting customers for 8 years. We've got over 450 groups. It's like 500,000 lives nationwide. So we got 500,000 people that have already made this decision to have standalone telemedicine and virtual mental health. So let's go through why that is. So of course, as you can see here on the slide, the whole point of virtualization of care gives you incredible access. You can connect within minutes. First Stop Health sets it up at no cost to the employees. It's unlimited use. Of course, you can do app or web or phone. And from a telemedicine perspective, you can think of it as virtual urgent care in terms of things like UTIs and rashes, sinus issues, what to do in your particular COVID situation. And then also on the mental health side, you also have depression, anxiety, that they need somebody to talk to. And so again, recently access to those types of mental health professionals has been a real problem. So to be able to do either of those, either through a video or through a phone conversation, has been very helpful. Next slide. So everything's got to be a list, right? So reason number one why standalone would be preferred over carrier embedded would be employee engagement. And of course, everyone uses this term employee engagement all the time. What do I mean by that? Next slide, Pete. What I mean is attention, because you can't help somebody until you can get their attention. And you can't get somebody's attention unless it's customized to them and it's relevant to them, right? We're each unique individuals, and all companies and organizations, municipalities, schools, etc., they're unique to other organizations. So there's no one single silver bullet to get people's attention. So the point is customization is the key. And this is where the standalone carrier embedded solutions, there's very little to no customization. So there's not a lot of collateral available. It's not customized. I mean, I work at a telemedicine company and we use Blue Cross, and I'm like, I wonder if Blue Cross even has telemedicine. And even when I was actively searching for it in my own employee benefits material, it was hard to find. So even when I was searching it out, it was hard to find through my own carrier. Whereas the standalone First Stop Health approach is we have ongoing account management with each of our broker consultants and their employer customers around what is the custom marketing approach. It takes sort of two forms. One, the messaging itself needs to be customized to the individual. We do what we call persona-based messaging, where the messaging about how to interact with First Stop Health and the ways that telemedicine and virtual mental health can help you is based on you as a person. In other words, the messages that we're sending to a woman in her 40s or a man in his 20s are different because they're very different people and they have very different needs, and the way that they would use telemedicine is very different. It needs to be ongoing throughout the year. And then the way that we introduce that to the employees is also specific to the employer. It could be hard copy letters, emails, text messages, postcards, worksite kits, social media. And I would even add that within a large, because we have, larger, 10,000 employee plus customers, that even customization within the type of employee or the location of the employee is also what we kind of specialize in. So we've got a warehousing company where, frankly, the language, the lingua franca of the people at their warehouses in New Jersey is different than the language that they speak in Indiana, because they have a lot of folks that were born outside of the United States working at these warehouses. So we have to customize the material by language. Likewise, whether it be blue collar employers or workers, whether we're doing stickers on the hard hats for the construction workers, or we're doing air fresheners hanging in the rearview mirrors for the truck drivers. The point is that we want to have that be customized to the employer, and we never charge any additional communication materials fees, because you want to be able to budget this and not have some sort of like random fee come up 6 months in. So it's all part of it. So you can see some of these personas here where we actually give them names. So like Mother Maria is a woman in her 40s. Gen X Jerry is a man in his 40s. Millennial Mandy would be a woman, let's say, in her late 20s. And so you can see just the imaging itself. We want to see people that look like us in our communications. And I'll also add too that we also add to the communications, the actual employer's, logo, color scheme, et cetera, so that people are like, okay, well, if your color scheme for your particular organization isn't First Stop Health red, that's okay. We can coordinate that so that it flows with your overall internal brand, if you will, for communicating with your employees. And again, all that is done by us. That is not put on you to try to figure out. That's what our account management team really specializes in. All right, next slide, please. So then reason number 2 is patient experience. Now, what do I mean by patient experience? What I mean is that on top of all the marketing material, the way that you get employees' attention within an organization is to create a wow experience for them. In other words, the marketing within your organization needs to be built into the service itself. And so a lot of times the carrier embedded solution, it's just not wow. Now, why is it not wow? It's not wow because you kind of go through this pre-registration process. They say, hey, look, do it in advance. It only takes like 30 minutes. Who in the world is going to pre-register for something, for an urgent care need? Like, nobody thinks that far in advance. Or shoot, I don't even think that far in advance. And then when you do have to connect with a physician, then the physician oftentimes isn't getting back to you unless like it's an hour or two out in the future. And we literally have customers that are wanting to sign up with us now for no other reason except for the response time for their current telemedicine vendor. It's just too long. And the employees are like, well, if the person's, let's say, a working mom, she has no idea what she's going to be doing in 2 hours, right? Because she's being pulled in a gazillion direction, but she knows that she's got 20 minutes, like right now. And so if she can get a call back right now, then she'll be able to bang out whatever her health issue is or whatever her kid's health issue is. If you attach a consultation fee, then a lot of times people don't want to spend the money. Either one, a lot of times the people don't have the money. I mean, all of you have heard the stats about people living from paycheck to paycheck. So to ask them to spend an extra $75, that's money that they don't have, which, oh, by the way, if you don't address that medical issue, then it gets worse. They end up going to the ER and the whole thing turns into a $5,000 healthcare event that could have been avoided if they had just, not had to have the $75 copay. And then it's not very wow from a mental and behavioral health perspective if you can only talk to a counselor like 3 or 6 times and then it's done, right? Because that's all the EAP offers. And so this is why First Stop Health over on the right has specifically designed our service to be wow. What does that mean? Wow means no pre-registration. At the time that you have the headache or the stomach issue or what have you, then right then and there, you can use the service without having to deal with some sort of huge checklist you got to do in advance. When you contact First Stop Health, either by app or by website, or you can just give us a call. A lot of our blue collar employers just give us a call, and we actually have live intake people to take in that information so that you don't have to use the app if you don't want to. But then we're going to get a doctor back with you on average within 3 minutes. So it's super fast. And it creates that wow experience. You can add family members to it, and it's no cost to the employee or the family member. And there's no limits in terms of how frequently you can use it, regardless of if it's the telemedicine service or the mental health service. And what does that create? It creates that wow experience so that they tell their fellow employees about it, right? It is remarkable. And the key part of the word remarkable is remark. They remark about it to their fellow employees. So You can communicate things up the wazoo, but if it's not remarkable and it doesn't have that confirmation of word of mouth within the employer, then it likely will not achieve the utilization that you want it to. So just know that having something specifically designed to be remarkable is an important part of getting value out of your telemedicine service. Okay, next slide, please. Reason number 3, to that end, is high utilization. What is the problem with every single one of these vendor and solutions? They all sound good. They all make sense in theory, but if nobody uses them, then they don't work. And so guess what happened to embedded carrier telemedicine? The utilization is low. And sure, it spiked in March of 20 when everything was shut down because of COVID, but it's come way back down to like less than 10% utilization. We do comparison utilization reports where we say, hey, look, for your embedded telemedicine service, give us one of your utilization reports. And we'll do a side-by-side comparison for like a similar industry to what we're seeing utilization-wise. And we're routinely seeing utilization reports of like 6% from the embedded carrier service. Now, what does that mean? That means the majority of it. Now, does that mean only 6% of the people need it? No, that's not what it means. What it means is that people just don't know about it and they have difficulty accessing it. And obviously, some telemedicine vendors don't even want to give you a ton of reporting because they don't want you to see how low the utilization actually is. And so here's the key differentiator for First Stop Health. If you don't remember anything else about this presentation today, it is that the First Stop Health average utilization is 44%. The point is people use it. People use it. And once they use it again. And I'm sure many of you are familiar with net promoter scores, right? It was new maybe 5-6 years ago, but people are kind of on board. The net promoter score, the scale goes from minus 100 at the low end to positive 100 at the top end. First Stop Health has a net promoter score of 77, which essentially is a numerical way of saying, wow. That is a wow response. And you want to be able, you as a broker consultant or as an HR benefits professional inside an organization, you want to be able to share that wow story with your executive team. And so to see the level of detail, both objective and subjective reporting in our detail allows you to tell that story throughout your organization so that you can share how wow it is for the employees and their family members. Next slide, please. Okay, reason number 4. Okay, so fine. So people use it. It's a wow experience. So what? Obviously, one of the main problems with healthcare in America is that it's too expensive. It costs too much. And everybody knows the healthcare cost equation. It is the number of claims you produce times the average cost per claim. So if we're going to decrease healthcare costs, we need to decrease the number of claims and or decrease the cost per claim. And so this is where the embedded carrier model, they're still billing claims on the back end. So if you're a self-funded employer, just know that whatever PEPM you're paying for your telemedicine service, that is not the cost of your program because they're hitting you with $90, $120, $140 claims on the back end. Now, you don't necessarily know if those claims that are being generated, if they're high value or not. And so, and also for budgeting purposes, you're adding to your own claims experience. Likewise, if you're fully insured and credible, you're adding to your claims experience. And essentially, you can think of standalone virtual care from First Stop Health. It's care without claims. We don't bill any claims on the back end. And I've literally had some brokers and consultants me, how is that possible? You don't have to bill a claim. There's no rule in order to have a state medical license to practice medicine. There's no rule that says you have to bill an insurance claim. And so you can have care without claims. You can have an on-site clinic that doesn't have claims. You can have a near-site clinic that doesn't have claims. You could have direct primary care that doesn't have claims. So you can think of this as capitated virtual mental health and capitated virtual urgent care, which at the end of the day, you want a fixed budget. You want to de-risk the financial volatility for your employer clients. So First Stop Health allows us to do that. and we charge a per employee per month fee. So you know that for X amount of employees that you're going to have, and you might have ads and terms, et cetera, but you know that you're not going to have claims impact. And I will add that, so not only are we not adding claims to your claims experience, but the point is to take claims off, is to take the claims off of specifically ER visits, urgent care visits, and doctor's office visits. And when we interact with a member, we call it a consult. When we have a consult with a member, we literally ask them, we do a short questionnaire at the end. We say, look, rate your doctor on 1 to 5 stars. And our doctors on average have 4.8 stars from our members. And then we also ask them, look, if you had not used First Stop Health, what would you have done? Would you have gone to the ER? Would you have gone to urgent care? Would you have gone to the doctor's office? And or would you have done nothing? And if we say that you would have done nothing, then we don't claim that as any sort of savings cost at all. But if we say, if the person said, well, they would have gone to the ER, urgent care, doctor's office visit, then we attach insurance in-network allowed amount dollar amounts to each one of those. And you can see the math on the reporting, right? Because one of the biggest things about the measurement is you want to be able to get line of sight into how it's actually calculated. So we actually give you line of sight into how that's calculated on the reporting, so that you're actually decreasing your claims, specifically in ER, urgent care, and doctor's office visits, because you're capturing them with this virtual care without claims. Next slide. Okay, now, one of the reasons why I'm working at First Stop Health is when the CEO, Blaine Barnett, and I were talking, he's like, look, we are all about alignment, where we want First Stop Health's success to be aligned with our customer success. And so along those lines, we offer savings and ROI and utilization guarantees. Next slide, please. So one of the challenges is that right now, if you have a carrier embedded program, one, there's not a lot of savings. There's not guarantees around utilizations or that savings. So, and listen, sometimes it's a free service, right? But it's essentially check the box. So if you've got this low or no cost solution that has no guarantees around it, guess how effective it's going to be? It's not going to be effective at all. And look, we understand that telemedicine is not some sort of, linchpin solution for some employers, but for and I'm gonna tell you the ideal client profile here in a minute. But the point is that the First Stop Health fees are based on a 125% savings guarantee, which means for every dollar that you spend on First Stop Health, we're going to guarantee back $1.25 in savings in those avoided ER, urgent care, and doctor's office visits. Now, we do that for the self-funded groups, right? Because there's more of a direct correlation between costs of the plan and those avoided claims. Now, for fully insured groups, it's a little muddier, right? Because you're paying premium. Is the group fully credible? Is it not? And so there we based it on a 25% utilization floor, where if you don't reach 25% utilization, we're literally cutting you a check back. And if you don't reach an 125% ROI, we're literally cutting you a check back. So that the point is that, if there are particular groups that have hard to engage employees, maybe the ROI is only at 100%. And so we literally lower our fees so that we actually then recalculate to 125%. So we literally cut checks. Or, as you can see, we have a 95% client retention renewal rate. So we can just apply the money to the next month's fee if they want to do that. Now, next slide, please. So before I say the summary, I want to tell you that. So I literally have been on over 75 calls in August with brokers and consultants, literally across the country. And the way, and also across our book of business, I'm working with the account management folks as well. Literally the way that folks are using First Stop Health, one, because the labor market is tight, a lot of groups are using First Stop Health and telemedicine as an attraction and retention tool, because they're having a hard time getting people to work at their company, and they're seeing their employees struggle. Now, First Stop Health is not a quote unquote insurance product. So we see a lot of employers that offer First Stop Health to all their employees, even the part-timers that are not eligible for major medical. Or you can just offer it to the major medical folks. That's fine too. But we signed up an 8,000 employee fast food restaurant chain that has a ton of part-time employees, and they were having a hard time getting people to work there. And so at the end of the day, they wanted to offer this service as a way to be like, look, if you work at this fast food restaurant, you're going to get access to a free doctor on the phone. Okay. Then the other group is to say, okay, look, you're looking at your reporting and you're like, hey, we still have high ER utilization. And then you look at your telemedicine reporting and it's like, we only have 6% utilization on telemedicine. So, obviously there's still a lot of people going to the ER who wouldn't go if they actually use telemedicine the way that they should. And I was actually shocked when I looked at our client base, how many blue collar employers that we had. So we've got a mining company, we've got multiple construction companies, we got multiple trucking companies, we got car dealerships. I mean, we've got all sorts of groups where, not to stereotype us men, but you've got a sort of thick-skulled men that are using the ER inappropriately. You're using it too much, right? Everyone's heard the stat about how about 50% of ER visits are actually shouldn't be in the ER in the first place. And so to be able to say to the employees and their family members, look, it's free. You use it as much as you want, and you talk to a doctor in 3 minutes. And at the end of the day, like, look, forget about the money. Like, I don't want to go and be around other sick people, right? You don't want your employees going to an ER waiting room and being around other sick people. You don't want them going to an urgent care center, being around other sick people. Like, just for infection control purposes, you don't want them being around other people. Okay. So we resolve 94% of the issues. And look, 6% of the time, we're like, look, it sounds like you might have appendicitis. You might need to go in. I mean, look, that happens. That's true for all telemedicine companies. It should happen. We want to send them to the clinically appropriate setting, which might need to be in-person care, but 94% of the time we can resolve it. Okay. So employee engagement, patient experience, high utilization, claim impact, savings, and ROI. So I understand you're not having, 2-hour existential conversations with your customers around telemedicine. But the point is that if they really need an attraction retention tool and they need an ER claims cost containment tool, then having this carve out telemedicine and virtual mental health service has been really something that it has been found to be useful for folks. And that's what I wanted to bring with you today. And so on with that. So many of you already know our sales team. We literally have sales team across the country. You're probably connected to them. If you are not, just email marketing@fshealth.com, marketing@fshealth.com. You are not going to get some sort of like standard auto reply if you do that. What you're going to do is you're going to get the geographically tied representative from First Stop Health personally reaching out to you. So don't think this is, some sort of like spam email address. It's not. So if you just email it to marketing@fshealth.com, then we're going to connect you with Martin or Krista or Tracy or whoever the right person is for your part of the country. And of course, if you just want to learn more on your own, you can go to firststophealth.com. We've got a couple minutes for questions. So let me just kind of pause there. And Nick, if you could help me out with the questions.
Yep, Dr. Bricker, yeah, we got a lot of questions. There's no way we're going to get through all of them. I got back to a few people on a couple of your questions, but let me pull a couple. We will last another minute or two here. We'll grab a couple questions that I think are relevant right now. So here's one asking about, we had a couple asking about mental health and how we compare with others. So just to summarize, for our mental health service, there are no fees for the member, even if they need to speak with a counselor 10 or more times. So it's asking about really what happens if someone needs to prolong care with our counselors for maybe 10, 15 sessions. Are there any fees involved? Dr. Bricker, can you respond to that one, please?
Yeah, sure. So that's the point, right? Is that the financial barrier to mental health has really been problematic. And some of these embedded telemedicine services, I mean, it's a minimum $120 copay. Some of them it's even $190 copay. And here's one of the reasons is because if someone has depression or anxiety or some other mental health challenge like that, that impacts the entire household, and it impacts the other aspects of their health. And so it is an area that really cannot be neglected. So even if you're looking at ER claims or diabetes claims, like literally cortisol in your system raises your blood sugar level. Okay. And also if you have somebody in the household who's got depression or anxiety, you have other people in the household who are being impacted by that person, which can then result in mental health claims or medical claims for them. So a family is a cohesive unit. And so if one part of every, I mean, look, we all live in families. If one part of that family, needs help, then that's going to help the entire family unit. And again, to do that in a way that's zero out of pocket costs and unlimited use is the approach that frankly we prefer because we see it's the most effective.
Okay, great. Thank you. Here's another one, and then we'll probably conclude after this. We actually received this a couple of times, people asking about just general embedded telemedicine. So here's one. Many of the clients that they have are embedded with telemedicine, which they say is free, and they put in quotation marks. So you're saying First Stop Health can be offered in place of that. So can you address exactly how the standalone works versus the embedded telemedicine?
That's right. It would be offered in place of the embedded, and oftentimes when the very basic thing that you have to do with the employees and the family members is be like, look, this is the number, this is the app, this is the website that you're going to now use going forward with First Stop Health, which for most of the employees, like it's a non-issue because they didn't even know that the existing telemedicine existed, right? So it's not like you're going to be switching them over from an old service to a new service because they never used the old service because they didn't know about it. So that does not create a lot of confusion around that. And a lot of folks, if you're receiving your embedded telemedicine for free, well, then you don't even have to you don't have to quote unquote turn it off because you're not even paying anything for it, right? If people stop using it, then they're going to stop generating the telemedicine claims on the back end, and you're done from a financial standpoint. Now, if you happen to be paying a PEPM, then obviously you can wind that down at the end of your contractual obligation to not pay whatever that fee is anymore. And so just know that those are typically, it's the communication piece and the financial piece, which at the end of the day for most embedded services, like literally all 450 plus of our customers, they all had embedded telemedicine. Like it's not like they didn't have something before, and they all had it and they all switched over.
Great. And then we're getting a lot of insights about, how do we get more information about First Stop Health? So I could just address this. So in terms of getting a proposal, getting more information, as Dr. Bricker said, feel free to email marketing@fshealth.com. Include obviously more information about you, like what state you're in. And we'll make sure the appropriate representative follows up with you. If you know who your representative is today, that's great. You can contact them immediately about this, but that's probably the best way to start today, tomorrow, to get in contact with First Stop Health. And then obviously use the website as you see on your screen here as well. So with that, I'd like to conclude. Dr. Bricker, thank you very much for taking the time to present today. Very informative. Again, we will send out a recording to everyone here in the next week. We will conclude now. I hope everyone has a great, safe, long holiday weekend coming up here. Thanks again.
Thanks, everybody.